Good day, class. In this video, we are going to study dysmenorrhea. Dysmenorrhea, firstly, the definition, refers to the pain in the abdominal region or the lumbar region before, during, or after menstruation. The time when the patient experiences the pain is very important for the definition or to diagnose this disease. Because whenever you see a patient presents with abdominal pain, you must differentiate is this abdominal pain from the intestines or is it dysmenorrhea. So firstly, when we differentiate or when we diagnose this dysmenorrhea, the first thing we must think about this disease must happen in females. So the females, dysmenorrhea, and the pain must relate to the cycle. So the patient will tell you that they experience the pain every month before the cycle, or a few days before the cycle, or the first day of the cycle. So the most typical symptom will be the pain accompanied with the cycle, especially a 1 or 2 days before or the first day. In some situations, the patient may experience some kinds of pain or mild pain in this situation, and especially if the pain will not affect their daily life or their work. In this situation, the patient doesn't need any treatments. So our treatment will perform on patients who experience dysmenorrhea or experience the pain related to their cycle, but severe, medium or severe pain that may affect their daily life. Then the patient will need some treatment for this. This disease is quite commonly happens in young ladies. There are two categories of dysmenorrhea: the primary dysmenorrhea and secondary dysmenorrhea. This is the definition or the term of these two categories are very similar to hypertension, primary hypertension and secondary hypertension. If you still remember, when we talk about the primary hypertension, we mentioned that the hypertension is the initial symptom from the hypertension itself, and there is no obvious cause that we can identify. The secondary hypertension actually results from other diseases, such as diseases related to kidney, diseases related to the heart, and results in hypertension, results in the elevation of blood pressure. So these are the very commonly in the category of primary and secondary for the medical terms. Same as here for dysmenorrhea. The primary dysmenorrhea have no pathological changes in the reproductive organs. The secondary dysmenorrhea results from other diseases. So you can see all those diseases that I have listed there. These are the common diseases. Which means whenever we see a patient with dysmenorrhea, especially if you see the patient after a few times treatment, after a few cycles of treatment, and you see no improvement at all, in this situation, you must suggest the patient to go to the gynae or other professionals for further examination to exclude the dysmenorrhea is from other diseases. The reason is because the treatments for these two different categories will be very different. For the primary dysmenorrhea, we are going to focus on the dysmenorrhea. We are going to focus on the reproductive organs, the uterus, the qi and blood circulation, particularly to the uterus. For the secondary dysmenorrhea, apart from relieving the pain, we must focus on the initial disease. Otherwise, you will never be able to treat the diseases. When you see the definition the pain in the abdominal region. If a patient tells you that they experience the pain in the abdominal region, especially in females, apart from dysmenorrhea, you also need to differentiate with the inflammation in the lower abdomen, in organs in the lower abdomen, or the inflammation in the reproductive organs. The patient may experience different pain. For the inflammations, the pain may not relate to the cycle. So from the definition, the time when the patient experiences the pain is very important. That also will help you to identify is it dysmenorrhea or other type of abdominal pain. So the definition we must understand clearly. Firstly, the location of the pain, and then the time or the duration of the pain. Dysmenorrhea is in Chinese medicine or in acupuncture, we record this quite early. So in 伤寒杂病论, which was about 159 AD, we already described that patients present with leukorrhea, irregular menstruation, and the patient may accompany with low abdominal pain. And the pain may present once or twice every month. In this situation, the author proposed one formula, but from the formula, we don't discuss the formula because our focus will be on acupuncture. But when you see the description from this clause, the author emphasized that the prosthesis in this situation. So he emphasized that the pain is the sensation of the pain is a kind of fullness. So the fullness, it can be the qi stagnation. The qi stagnation made from the prosthesis. But for this clause specifically, when we see from the formula, we will know that this clause, it describes the pain that's due to prosthesis. In another text, the author discussed different causes, different possible causes of dysmenorrhea. It described as the patient, the lady, will present as abdominal pain when they have periods. This may cause due to qi deficiency, due to blood deficiency. It also may be caused due to external wind. The external wind, especially the wind cold. The wind cold attack the uterus. So this may result in dysmenorrhea. The wind cold attack the uterus, attack the Chong meridian, Ren meridian. So from this clause, we understand that the causes for dysmenorrhea may from qi and blood deficiency, may from weak body. The qi and blood deficiency will result in weak body constitution, and in the meantime, the patient was attacked by wind cold. So the wind cold will stay in the Chong and Ren meridian. From this clause, we will know that the author emphasized the Chong and Ren meridian. This is very important, especially for us, for when we study acupuncture. The reason is because when you see dysmenorrhea in future, you can think about Chong meridian, Ren meridian. So you can use the points on the Chong meridian, on the Ren meridian. That's why we will use Ren 4, Ren 6 quite often for dysmenorrhea. In Ming Dynasty, about 1,000 years ago, another author proposed that dysmenorrhea we must categorize into two categories: excess and deficiency. So the author described it as that for excess dysmenorrhea, it may due to cold stagnation, due to prosthesis, due to qi stagnation, due to heat. So already give us coldness, paralysis. So firstly, stagnation. Stagnation may due to qi stagnation, may due to the heat. Actual excess heat may result in stagnation. Qi stagnation, heat. And then paralysis may result in stagnation, because once the blood doesn't move, the qi also doesn't move. This is from the basic theory. The blood is the carrier of qi. And then apart from the stagnation, so stagnation may be qi stagnation, may be blood stasis. Blood stasis results in qi stagnation. Maybe stagnation due to heat. So there are three causes: qi stagnation, blood stasis, and heat, excess heat. Apart from these three, it also can be the coldness. So the cold inversion, the coldness also may result in excess syndrome of dysmenorrhea. There are also deficient dysmenorrhea, such as due to blood deficiency or qi deficiency. So in our clinical practice, how to differentiate? Is this from qi deficiency? Is this from excess or deficient? There are a few symptoms that can help us to identify. Firstly, for the feeling, the sensation of the patient, for excess pain and deficient pain, the patient may experience different type of pain, or deficiency, or heat, or excess. And then from the time, why I emphasize the time when the patient experiences dysmenorrhea is because if the patient experiences pain before the menstruation or during, especially the first 1 or 2 days of the menstruation, and then once the period starts, the patient feels relief, the pain relieves automatically. So this is an excess syndrome, dysmenorrhea excess syndrome. The reason is because before menstruation, the qi and blood circulation increased, and then the patient experienced the pain, and then increased qi and blood circulation, and all of a sudden the blood start to flow, the lady start to bleed. So we reduce the qi and blood in the specific region, reduce. So this is the pain due to excess, due to actual qi and blood in the body. That's why relieving bleeding the period, bleeding in the period will relieve the pain. That's why the pain starts before or during the menstruation, and once the period start to flow, the blood start to flow, the patient feel less pain. In the contrary, if the patient presents experience the dysmenorrhea after menstruation, so in the later few days, or during when the period almost stop or even completely stop, the patient start to experience the pain. There's also deficient pain, but this type of pain, the sensation may be different. In diagnostics, we describe it as a type of hollow sensation. The patient also prefer to be pressed on in the lower abdomen region. So for excess and deficiency, you can identify from these a few symptoms. The sensation of the pain, you must ask the patient, try to describe the sensation. What type of sensation? And then the time when the patient experiences the pain. Whenever we see diseases or symptoms related to pain, we also always need to reflect to two conditions. Blockage, wherever there's a blockage, there's a pain, or malnourishment, wherever there's no enough blood supply, then the patient may present pain. So these two will be the principles for your treatments in dysmenorrhea. So from the etiology, anything that may result in liver qi stagnation may result in qi stagnation, or other stuff may result in blood stasis, qi and blood stagnation, qi stagnation or blood stasis, or other diseases or other situations may result in deficiency. It can be exercise deficiency or blood deficiency. It also can be qi deficiency and contribute to these two can contribute to dysmenorrhea. When you see from the back to the front, so that dysmenorrhea can be categorized into excess and deficient. And then you must think about the symptoms or the possible causes for these symptoms, qi deficiency or blood stasis. So when you see the etiology, this is what you need to write in your case, in your pathogenesis explanation. So when you see the case, when you write a case in clinic, I will ask you that you need to explain why this patient will present as for this problem. So the pathogenesis diseases, pathogenesis explanation, how to explain all these symptoms. You must explain from the etiology. What are the causes? The causes may relate to patient's age. For example, this patient may be 32 years old, female, and always depressed, always don't feel happy. This is the lady's personality. So these can be the potential cause. This can contribute to liver qi stagnation. So you may describe that this patient may present at this, have all these item 1, 2, 3, the age, gender, and depression or anger, or the other lady always work in a cold environment. So these may contribute to and then result in liver qi stagnation. That's why the patient presents as dysmenorrhea. The qi stagnation, especially the qi and blood stagnation, results in the Cong and Ren meridian. So that's how to explain these symptoms. The diagnosis of this dysmenorrhea, the lady may have a history of dysmenorrhea, and this dysmenorrhea may or may not accompany with the irregular menstruation, especially the volume of the blood may or may not accompany with infertility or other inflammation in female reproductive system. The main symptoms will be lower abdominal pain and the duration before, during, or after menstruation. The most common situation will be the first before the periods, 1 or 2 days before. And in most situations, the first day of the period will be the most severe pain. This pain can present as comes and goes, can be kinds of spiral sensation. The patient also may experience a heavy sensation or a downwards moving, so they feel the lower abdomen is something pulling downwards. In some severe condition, the pain may refer to the lumbar region, the anus region, or even in the thigh, in the inner part of the thighs. Most typical pain is in the lower abdominal region. So in this situation, we also need to differentiate: is it acute appendicitis? For other situation, if the patient presents with low abdominal pain, so how to differentiate with appendicitis? Firstly, the location of the pain. Appendicitis, the location is typically in the right lower abdomen and 1/3 from the outside, and the pain is also rebounding pain. The other situation that you need to consider is pregnancy, especially in ladies in their young age. You must exclude the possibility of pregnancy, that the pregnancy is not in the uterus, it's in the tube. How to exclude? You must ask the patient the history of their period, and sometimes you must perform the urine test for pregnancy. These are the common diseases that you need to exclude in your differential diagnosis. The symptom differentiation, I'm not going to go through one by one, but the symptom differentiation will be very similar to the other disease, and you're going to analyze from diagnostics, the knowledge in the diagnostics. For example, the qi and blood, qi stagnation and blood may result in something purple, may result in clots, this is stasis. So in your treatments, you also will focus on activating qi and blood circulation, such as level 3, large intestine 4. So these points you can use here. Cold dampness, because of coldness, the patient may experience the cold pain, the cold sensation, a cold pain, and the pain may be severe. The pain may be relieved by warmth. In the treatments, you may use Moxibustion, you may use round 4, round 6, the reinforcing technique, especially the comprehensive reinforcing technique to reduce coldness. For qi and blood deficiency, dull pain, so the sensation, that's why I say the hollow pain or dull pain. The sensation is very different after menstruation. Scanty light pale color, that indicates the deficiency. Because of blood deficiency, that's why the patient presents with scanty mens. Deficiency, qi, especially yang qi deficiency, presents a light pale color, pale complexion, physical weakness, fatigue. In a pale tongue, enlarged tongue, teeth mark. Liver and kidney deficiency, this is also similar to the exons deficiency. The patient will present as lower back. The weakness of lower back and knees. This is very typical symptom for kidney deficiency. Tinnitus, vertigo, illness related to kidney. Acupuncture, especially in the acute attack for dysmenorrhea, acupuncture is quite effective to relieve the pain. The treatment principle will be regulating the qi, activating the blood, regulates the Cong and Ren meridian, nourish the qi and blood. So these, you don't use these all the treatment principles all together. These treatment principles will be determined by the surgeon that you have identified in specific case. For example, qi and blood deficiency, you're going to use nourish qi and blood. For qi and blood stagnation, you're going to regulate the qi, activate the blood. The points you're going to use room 4, spleen 6, room 6, spleen 8. You also may choose some points that's in the lower back region. You're going to focus on Ren meridian and spleen meridian. The spleen meridian, especially for the deficient symptoms. For prevention, if the patient experiences dysmenorrhea every cycle, so the patient want to prevent for this cycle, you can start the treatment 1 week, 5 to 7 days before the period. You can continue for a few cycles. You can stop the treatments on the first or second days of the period when the patient experiences less pain. And then for the next cycle, you may start again. To treat these diseases or to recover or almost to heal this disease may take a few cycles. But this patient does not need the treatments every day, but only 5 to 7 days before the period. Before the period, they must have the treatment every day. Okay, every day, 5 to 7 days before the period, but not every day over the cycle. For different symptoms, you may add other points. C and blood stagnation, level 3, spleen 10 for blood. So we talk about 血海, spleen 10. 血 is the blood, the C of the blood. Blood 32, that's the points at the back, in the lower back, actual B9. Cold dampness, you can use above points with Moxibustion. Apart from these treatments, another very common formula that you can use or diet you can use is the lady may drink ginger and brown sugar tea. So how they're going to prepare is they're going to use the fresh ginger. They're going to cut the fresh ginger into slices, about 3 to 5 slices. It can be this big. So it can be a ginger similar to this size. When you can see the size of a mouth or half of the mouth. So 1 slice. The lady can use about 3 to 5 slices and then add some brown sugar and go through the way how we prepare herbal medicine. And then the lady can drink the ginger brown sugar tea. This also can help to relieve the pain, especially the pain due to qi stagnation, due to coldness, and due to blood stasis. So this diet or this formula or this decoction is recommended for most situations. The reason is because the property of brown sugar and ginger. Ginger is warm and pungent. Pungent can activate the qi and blood circulation, can activate the liver stagnation. Brown sugar is sweet. Sweet can tonify. Sweet can mitigate the pain. So can relieve the pain directly. Sweets also can tonify the deficient. So when you go back to the symptoms, you will see ginger brown sugar tea is suitable for almost all type of symptoms. That's why this is very common for ladies when they experience dysmenorrhea. The first choice is they can use this simple diet. If they still experience pain, then we can perform acupuncture treatments in this situation. In this video, we discuss dysmenorrhea. The definition of the dysmenorrhea, firstly, the location of dysmenorrhea is in the lower abdominal region or the lower back. Second, the time when the patient is going to feel the pain. It must be related to the period. So it depends on the cycle of that specific person. It must be related to the cycle. So this is the definition. And then the treatments, you can perform the treatments when the patient feels pain or 5 to 7 days before the period if the patient have a regular period, regular menstruation. So these are the key aspects that you need to memorize. And especially in terms of the definition, whenever we study the diseases in therapeutics, the first thing you need to understand or you need to memorize is the definition, because the definition will help you to diagnose this disease. Although the syndrome of dysmenorrhea can be excess or deficiency, as we have explained, in more common situation, excess syndrome is more common. And acupuncture is quite effective for primary dysmenorrhea. For secondary dysmenorrhea, after you relieve the pain, you must advise the patient to seek for further treatments or further examinations to find out what are the initial disease or diseases. In the patient's advice, you also need to advise the patient to avoid cold stuff, raw stuff, whole foods, or raw food, as we have mentioned quite a few times. Or what we need to do, especially for pain due to coldness, a patient presents with pale complexion or pale tongue. Avoid cold, avoid raw. Thank you for your attention. In the next video, we are going to discuss amenorrhea.